not business as usual, okay? I've seen that people are finally coming to grips that the tools we used yesterday are not going to be the tools that's going to make it successful tomorrow.
We do what we call our dementia modules within Hillcrest Health Systems. We were able to successfully reduce antipsychotic medication use by 65% the first year that we were open, and that was back in 2001 before the huge quality initiatives and the big push.
Our mission statement at iCare is enriching the lives of the residents we serve. Simple. So we've actually invested at this time an actual resource that we've added on staff, a person that we call Director of Patient Enrichment.
Education is very important to us. Education for their job, not just on-the-job training. We also reimburse our employees fully for tuition if they go to college.
The American Healthcare Association Gold Award means the world to me. It means the world to our staff.
We worked hard for it. We did the Step 1 award, the Step 2 award, and then when we received the award, it was just ecstatic. Everyone was ecstatic, and we're still on cloud 9.
I take the clinical processes that the nurses have and I integrate it with technology. They notice a complete 180 in the nurses' stress level. They noticed a lot more time was spent with the nurses and away from the documentation and away from their charting stations. We decreased our medication errors by 67%. Hospital readmissions have decreased by 24%.
We have implemented Interact in several centers, and I have been so astounded at the results. We've had one center that has reduced their hospital readmission rate by over 50%.
When our association president was testifying before the New Jersey legislature on budget cuts and Medicaid, the chairman of the committee asked him, is anybody listening to you? Do people understand what you really do?
We took him through a facility in a rural part of the state and then transitioned to an urban area to see the differences in the type of facilities and what occurs in them. And it was quite eye-opening for him because the idea of a nursing home in his mind was not what he saw.
I'm seeing that our representatives, the past 3 or 4 years especially, are listening because I stay on them constantly. And that goes right on up to our congressmen and our senators, and that's very important.
One of the things we've done is created advocacy centers in every facility. We thought it was important that our employees, even our direct care specialists, the employees that take care of the residents every day, know what's going on in Washington. Every time that we have a push for letters, whatever the issue might be, we usually generate within 2 to 3 days 5,000 letters each time.
When we receive notices from our Arizona Healthcare Association, we post these documents throughout the facility. We talk about them at all staff meetings. We incorporate them at resident council meetings so that we can communicate what our issues are regarding long-term care and solicit the support not only of our staff, our residents, but our community as well.
We'd like each administrator to raise funds for 3 distinct and individual PACs. So each facility has a goal of raising $500 for each of those PACs. And over the last number of years, each facility has really attained those goals. And some have exceeded it to the area of $300,000, $400,000. It's got families involved. It's really become a grassroots effort in terms of raising dollars to help us fight the issues here in Washington.
We want to be a step ahead. We want to survive. We want to let them know that we are the solution.
World class is not just a word or a saying, it's a lifestyle.